Good morning and welcome to the Windsor-Essex County Health Unit's media briefing for Wednesday, September the 21st. We are joined today by our acting MOH, Dr. Shankar Nesathare, as well as our CEO, Nicole Dupuis. We will move right into our round of media questions this morning. We will start with questions from Blackburn.
Yes, can you hear me okay?
Yes.
Yeah.
Okay, good. So I was going through the stats that were released last Thursday, and they mentioned that there was 344 new high-risk cases, 13 active high-risk cases. Are you concerned about a big uptick in cases in high-risk settings right now?
Yes, we remain concerned about the burden of COVID in the community. The number of positive cases is probably an incomplete number or an underestimate of the number of people actually currently infected with COVID. I think the things that we have to consider are what are the things that we can do to renormalize the burden of COVID in the community. And those are the things we have recommended previously, which is to improve vaccination rates. If you're eligible for a vaccine, to come up to date with your vaccination, to wear a mask indoors, or when you can't remain consistently 2 meters away from other people, get your flu vaccination when the flu vaccine is available. And I think that moving forward, we just have to be cautious and consider that the fall is there will be likely an uptick in respiratory disease. And we just have to learn to manage that and continue on with our regular activities as well.
Speaking of vaccines, Nicole, you mentioned last week that you might be able to speak to the uptake for the bivalent vaccine this week. Can you speak at all about the uptake for that?
I can't give you exact numbers, but I can say that we do have our appointments open and they are not completely full. So obviously we would like to see every opportunity taken. It is still open right now for, priority populations, and majority of that rollout is happening, in settings such as long-term care and retirement homes. But for anyone who, is part of that prioritized group, certainly there are appointments that are accessible. And then we look forward to the broader, release that'll happen soon for everybody.
Thank you.
Yeah, and if I could just supplement that, we anticipate that there'll be a broader availability of the bivalent vaccine to all members of the community. The public health service is just one pathway for receiving the vaccine. Like with other vaccines, there are pharmacies, physicians' offices, clinics that also will provide distribution of the vaccine. And it's my belief that everyone who wants the vaccine will have an opportunity to get it in a timely manner. We encourage people to come up to date on their vaccines, not only to help themselves, because vaccination will make it less likely that you'll get seriously ill from COVID, but you're also helping other people.
Thank you.
We will move to questions from the Windsor Star.
Just to follow up on Adele's question, so eligibility for the bivalent vaccine opens up to all adults as of September 26th. How are we doing? I know demand for the boosters hasn't been high, but how are we going to have sufficient supply for whoever wants the bivalent vaccine at that point?
Well, I'll let Dr. Nesathare repeat, I think, his sentiments in that.
Well, the procurement and distribution of vaccine is a federal and provincial matter, but I do not anticipate, I anticipate that everyone who wants the vaccine will be able to get it in a timely manner. If you wanted more granular responses related to vaccine supply, that would probably be something that provincial and federal authorities can comment further on. But from my vantage point, I think we'll have enough supply to get vaccine to people who would like the vaccine.
Just quickly shifting gears to the school immunizations. So last Wednesday, it was 1,519 suspension notices issued. Does the health unit track if those suspensions are ongoing? How many people have updated their immunization records since then?
Well, Nicole can maybe supplement this, but I think as of The most recent data, there are approximately 19,000 high school students, all but 223 have become up to date in the vaccine verification process. So the numbers have declined to 223 is the most recent data element. The thing I think that was the more important issues is that we have more than 18,000 young people who are up to date on their vaccine. And vaccine is one of the cornerstones of maintaining a healthy community. So to the extent that we as a community had to work hard to engage in the vaccine verification process, I think it's also something we can feel is a public health success to the extent that we've got young people vaccinated to this level of vaccine. Vaccine preventable diseases are making a reemergence worldwide, and I think that we have to be vigilant in Windsor-Essex to keep the community safe.
Thank you.
And we'll move to questions from AM 800.
Just to follow up on that question about the students' immunization, Nicole, so like Doctor just mentioned, 223 are still suspended. So obviously a lot of progress has been made in the past week. But is there a limit on how long these students can be suspended for?
Yes, I think the Immunization for School Pupils Act limits the suspension to 20 days. Nicole can correct me on that, but it's 20 days. But the truth of the matter is that we don't, the Public Health Service wants to, it's not about suspension, it's about getting people vaccinated. And to the extent that we can get people vaccinated and young people vaccinated, I think that's the real goal. We'd like to get that number down further from the 223, and I'm hopeful as days progress that that number will decline.
When it comes to the vaccinations for students, and like you just mentioned, the importance of getting them vaccinated, obviously with the pandemic, there's been pushbacks with the COVID vaccine. Has it shifted? And I know the School Pupils Act has been around for a very long time, but has attitude shifted? Is there hesitancy from individuals? Is the health unit hearing that? That's why some individuals are not getting it updated?
Well, I think that it's complicated for sure. At one level, I think it's a wonderful time that patients and people that we serve are more knowledgeable about what the treatments and interventions that they receive from their doctors. So that's a good thing. I think that it's perfectly appropriate for people to have questions and have those questions answered appropriately. But I also think one thing that's not changed is that parents have a deep love and affection for their children. And as parents, we want to do what's best for our kids. Getting vaccinated is the best choice for children. And you know, we offer a whole variety of vaccines in Ontario, and they're free of charge. And there's a fulsome distribution system. And some of those vaccines are really essential. I think it's essential that young people get immunized for meningitis. That's a contribution that I think that every parent can make for their child to bring them up to date before they go off to college or before they go off to university or before they join the workforce. I do think that there's a group of people that have been reluctant to vaccinate their children, and those people will continue to have the opportunity to articulate their beliefs. But I think the vast majority of people support vaccination, and I think in this particular case we had 19,000 people. I think we had 19,000 people, young people in high schools, and all but 223 up to this point have become up to date in the vaccine verification process. So I think it's a complicated issue for sure, but I think the vast majority of people embrace vaccination as one part of maintaining a healthy community.
Thank you.
We'll move to questions from CBC.
Yes, good morning. Apologies if this was already asked. I joined the meeting a little bit late. But Doctor, I'm wondering if you can talk a little bit about the risks of West Nile and how prevalent you think infection might be, considering that lab testing would have to confirm any cases?
Well, I was just looking at the data this morning, and I could send you the data, but West Nile is a relatively rare disease. We've seen it before. We'll see it again. I think that there were approximately 40 people infected in 2020, and there were 2 deaths. I think doctors at hospitals are cognizant of that as being a potential cause of illness, and they'll investigate it as appropriate. I think that we're always sensitive to the various infectious diseases that affect our community, and I think that it's worthwhile to follow that along. But I also think that we have to consider that we have other public health issues that are also important. I think in these past few years, about 600 young people have died of opioid overdose, and that too is a pressing concern for the public health service and for the medical community and for the community overall. So I remain concerned about West Nile virus, but I think we have to place it in the appropriate context of its burden of disease.
Those statistics you mentioned, was that province-wide or locally?
Let's see if I can get it. If I can manipulate my computer, I'll see if I can get it for you right now. But those are provincial numbers. If you have 1 minute, let's see. If I can't get it for you quickly, we'll have someone send it to you. Here, this is from the Public Health Ontario website. And in 2020, in their webpage, in the webpage caption, West Nile virus illness data at a glance, there were 102 cases, which is 0.7 cases per 100,000 people, 41 hospitalizations, and 2 deaths. And you can get that right from the Public Health Ontario website. I hope that's helpful.
It is. Thank you very much. Also, I wasn't at the last few briefings, so apologies if this was addressed the last time, but is there any update on the supervised consumption site? Any progress there?
Sure. Maybe I can ask Nicole to comment on that item.
Yeah, I feel a bit like a broken record, but there is progress being made, even though it's not visible. So as noted before, we have applied for an urgent site, and we have been in communication with Health Canada in that regard. The last step in that process is actually a virtual inspection, and but there are some modifications we have to make to the physical site itself before we can do that last step in the process. We've also submitted a full application for the full site to Health Canada, and have been communicating on that application, and have also submitted, as everyone would be aware, the application for funding through the Ministry of Health for Ontario, and have been communicating back and forth with the ministry. So there's lots happening around the site. We've been working on, procurement for the construction, so the modifications that have to be made. So simple things like, making sure that the bathrooms are accessible, modifying the entryways. So, some electrical to make sure that we can set up all of our equipment and security. So those are the things that are happening behind the scenes. We would love for them to happen quicker, but they are moving along. So we'll hopefully have much more to share in the future as more activity happens on the physical site itself.
Thanks very much.
We will move to our round of follow-up questions with 1 question per outlet. We will start with Blackburn.
No, thank you. I'm good.
Any additional questions from the Windsor Star?
Yes, Nicole, I believe that this is going to be your last briefing with us, and you're leaving the organization entirely in 48 hours. Any thoughts and reflections on that?
Yeah, if I talk too much about it, I do get a little teary, so I'll keep it brief. It is my last briefing, and I have more reflections and thoughts than I could probably share. But my only is just that it's been a gift to work at the WICHU and with the excellent team here. And despite COVID being quite the challenge for all of us, I'm proud of the work that I personally have been a part of, and proud to have worked alongside Dr. Nesathury and the rest of the folks here at the WICHU, and really appreciative of the community partnership and support that we've had along the way, or that I've had, and that includes yourselves in the media. So yeah, it's a bittersweet goodbye, but you won't be seeing my face, at least at this anymore, but just a big thanks would be the only reflection I would have.
Well, thank you very much for your time and your efforts, Nicole.
Thank you.
Thanks. We'll move on to a follow-up question from AM 800.
I do have a question, but Nicole, thanks for everything during these briefings and even covering the board meetings. I know you've always been great with us, so thank you. Doctor, I know we've asked you this question before, but obviously things are changing when it comes to the ArriveCAN app. Just want to see if you want to make any comments. If it does get removed, are you okay with that, or would you like to still see it stand? I believe their sources saying it could be optional. Do you have a stance?
Yeah, you know, my perspective is the ArriveCAN app is a federal initiative, and the constructs related to starting it and discontinuing it or making it optional are really for the federal authority to comment on. And we continue to work with federal and provincial officials on a variety of matters, but in this particular case, I think it's best that federal officials comment on that.
Thank you. Have a good day.
And a follow-up question from CBC.
Yes, I do have one follow-up question. It's from my colleague. He's seen a tent on Alette north of Erie that says it's a vaccination clinic, and I was wondering, does the health unit have anything to do with that, or is it the hospital? Is it maybe for people to get the new updated vaccine?
Yeah, so it is ours. It is the health unit tent. That's actually one of our parking lots. And so with the expansion of vaccination with the bivalent, and as well our continued effort for getting kids up to date for the school vaccinations, in order to ensure we had more appointments and space, we have the tent up and are booking in both our indoor site as well as the tents outside.
How long do you anticipate it'll be open?
I'd have to get the exact, I think right now it's for a few weeks that we are planning on using the tent facilities outside.
Thanks very much.
I think the weather might work against us after that point.
Fair enough. Thanks very much for everything, Nicole.
Thank you.
That concludes our media briefing for today. Thank you all for joining us. Our next scheduled briefing is next Wednesday, September the 28th. Thank you very much. Have a great day, everybody.
Best of luck, Nicole.
Thank you all very much.
And a great life.
Thank you.